Feel well at FadiSab.
Scoliosis is a condition where you develop a curve in your spine. It can be a C curve or it can be an S curve. These curves can often show you a sign which is uneven shoulder or uneven hips. So if you see these signs, you might have scoliosis. So how do you know that you have scoliosis? The common signs, if you can see yourself in the mirror or ask someone to look at you while you are bending forward, which is forward bending test. You have uneven shoulder, uneven hips. On other side, if it's on the right, then you have a dextroscoliosis. If it is on the left, you have a levoscoliosis. That's not the only basis that we can use to diagnose that you have scoliosis. We use this kind of test to just see if you are suspected to have scoliosis. Now, let's say, for example, you have done the forward bending test and you ask someone to observe you while doing it. You are positive with the shoulder asymmetry and positive with uneven hips or positive with forward bending test. The best thing to do is visit your doctor or to us, because we will be asking you to have an x-ray, and that's our only basis to diagnose you if you really have scoliosis. Now, let's say, for example, that you have done your x-ray. We will now use it to check for the severity of your scoliosis. Now, if it is mild, moderate, or severe. So mild is just a degree that ranges between 10 to 25 degrees. Moderate scoliosis, however, is 25 to 40 degrees. And severe scoliosis ranges between 40 and above. Now, what to do if you have those kind of severity? For the mild, it's observation and to have therapy. For the moderate, that where bracing will come in. For the severe, most of the doctors will tell you surgery, but that is still will depend by your doctor. Now, there is a myth that if you have a curvature 1 to 10, then you are having scoliosis. Well, the answer for that is no. Any curvature that is less than 10 degrees is not considered as scoliosis. Because remember, we are not perfect. We may have a bit of shoulder asymmetry or a bit of uneven hips, but that doesn't mean that you are having a scoliosis. Now, you might be wondering, what is the cause of scoliosis? The common cause is actually idiopathic, meaning it's an unknown cause. It may be genetic or for unknown reason that you have your scoliosis. Some may be telling you that you develop your scoliosis because of your poor posture or from bad habits. But that is not necessarily the main factor why you're having your scoliosis. One thing I want to clarify to you guys that no amount of exercises or therapy would really fix the scoliosis. If you have a 30-degree kind of curvature, no amount of therapy that it will fix it to make it zero or normal again, unless if you will have your surgery. But what we can do help you is with, if you're suffering from a back pain because of posture-related problem or because of stress or because of overwork, then we can help you. So the main goal again is to avoid having the scoliosis increase and managing your posture-related problems. So if you know someone or you are wondering that you might have it but not sure, kindly visit us here in FadiSab Physical Therapy Clinic. Feel well at FadiSab.
Feel the love and feel the cheer.